Welcome to Impact 100 East Bay community discussion focused on COVID resilience and recovery. We hope this evening will provide an engaging and enlightening forum for us to collectively learn from each other and grow our understanding of what is transpiring in our communities in terms of COVID-related challenges and progress made. My name is Judith Fewer, and I am a member of Impact 100 and a partner on the community events team. We welcome you tonight, along with our esteemed guests who will be speaking with respective areas of their expertise. Many of you are familiar with Impact 100, but some are not. Impact 100 was founded by Wendy Steele in 2001, uniting and empowering women to give together, creating transformational impact. Desiring to extend this philanthropic model, Impact 100 East Bay was started in June of 2016. And in 2017, we initiated our first grant. We've awarded $500,000 worth of high impact grants that reach our local underserved populations and enable us all to do more. Welcome to all of you and our guests. We have 4 speakers who will speak for 10 minutes each, followed by an open Q&A. Feel free to either put your questions in the chat or raise your virtual hand following the last speaker during our Q&A session. I will introduce our speakers just before each of their segments, and we have the 4 segments noted there. So first, we will lead off the evening with an overarching perspective by Kathy Young. Kathy co-founded Tri-Valley Nonprofit Alliance in 2014 and currently serves as its president and CEO. Kathy developed a passion for the nonprofit community as TVNPA grew, and she learned about the hundreds of nonprofits working in our communities every day to improve our quality of life. Kathy recently served as COO of Quest Science Center and now serves on their advisory board. Prior to Quest, she spent 13 years with the Fannie and John Hertz Foundation, most recently as the executive director of the Hertz Fellowship Programs. Welcome, Kathy, and I turn it over to you.
Thank you, Judith. And just a second. Okay, so good evening, everyone. I'm excited to be here, and thanks, Judith, for asking me to participate. I have a timer, and I'm going to set it. Of course, okay, ready, go. With TV, I'm the president and CEO of Tri-Valley Nonprofit Alliance, which Judith mentioned, and we work with nonprofits to help them build capacity through many different channels. We are the Tri-Valley Nonprofit Alliance, but we serve nonprofits all over the Bay Area. And now since we've gone online nationally and even globally, most of our meetings are free and open to anyone who's interested in attending. So check us out at TVNPA if you're interested in learning more. I'm here to talk briefly on 3 topics. The first is relationships between nonprofits and our government agencies. The next is on how nonprofits are doing at this point in the pandemic. And finally, how local nonprofit constituents are faring during this time. I have 10 minutes, so this will definitely be just an overview. I have a puppy, and so you might hear him squeaking his toys in the background. So nonprofits serve a wide range of people. Most nonprofits, 55%, have programs that serve the general public. Sorry. Okay. And these could be arts organizations, institutional organizations, sports, special needs, etc. Then there are the 45% that focus on people and families below the poverty line, as well as those that provide programs that focus on marginalized groups, which is the group we're talking about this evening. The US has about 1.8 million nonprofit organizations, with 501c3 nonprofits accounting for approximately 75%. Can we go to slide 2?
Yep.
I'm going to take a minute and just talk about the relationships between go back up one. talk about the relationships between nonprofits and the government agencies. I'm truly grateful for the nonprofits that fill in the gaps of public service delivery. Why? Because nonprofits tend to serve with less bureaucracy and more compassion. Governments provide funding, usually in the form of grants, so that their reach can be extended. And there's a picture, it's quite blurry, but shows some of the different going back and forth between organizations and the nonprofits. Governments provide usually in the form of grants, and then nonprofits can also raise money to support their services. And in some cases, they can charge fee for services. They are accountable to both their funders and their constituents, which makes this work out quite well. I was thinking about some of the organizations that might benefit from being run by a nonprofit organization. So we can go just to the next slide. And I thought I'd like the DMV as an example. Wouldn't it be nice if it was run by a nonprofit staff that had a passion for helping people, get their problems solved, their licenses renewed, whatever their problems are, and had passionate volunteers there. I thought of the Passport Agency, Social Security Administration, and more. Imagine the homeless department of what that might look like. To me, it just looks like a big sterile room, or the senior department. So nonprofits can replace sterile bureaucratic environments with passionate and caring employees and volunteers. And so I just was picturing the difference between that. Thank you for slide 4. In preparation for tonight, I did some research nationally and to just get a broad overview and how they might compare to locally. And so overall, nationally, nonprofits took a decent hit, 40% overall on an average, lost revenue. And talking to the organizations that serve direct service organizations in our area, what I learned was most of them did okay. Can you go to slide 5, the next one? And this was because there was such an outpouring of support. They received PPP loans, special government and foundation grants, donations were up. And so the nonprofits, they did okay. There was an outpouring of support so they could say yes and serve just about everybody who needed help. This changed in 2021, and I am quoting, the second year was the hardest year ever. The second year was harder because federal money started to go away. Foundations giving money because of COVID work stopped, donations slowed, and it's just not seen anymore. And now the need is still just as great, if not more so. Open Heart Kitchen, they're a local food pantry in the Tri-Valley area. They went from serving 350,000 people before the pandemic to more than 2 million in 2021. That's just such a huge leap. The baseline service is continuing to rise, but the support is not as strong. The executive directors are worn out. Many are sick or retiring. We're having a huge turnover in the nonprofit leadership in our area. We aren't required to wear face masks any longer, but the pandemic and its effects aren't even close to being over. Hunger is still high, as I said, worse than before the pandemic. The child tax care credit expired and hasn't been renewed. The rent moratorium ends June 30th. While unemployment is low, housing costs have increased so much that if you have less than a 6-figure income, you can put someone in a position of having to choose between food, gas, rent, childcare. A lot of people are depressed. They lost their social networks. The healthcare system did not do well by a lot of people. Many seniors could not use telehealth. Cancer went undiagnosed and diseases got worse. Seniors are often still afraid to be around people, and there are a lot of others who need real attention. There is a huge recovery ahead, and many people will be left behind. Historically, there's never been an equitable recovery from any disaster. Those who were doing well before the pandemic will likely continue to do so. Right now, the #1 call to CityServe, what they're receiving is for housing. Those who were on the fence before are now in danger of falling into homelessness. And the rest will be left behind as usual. So again, it's not over. The hope for opening up is that volunteers can now get out there to help, which will put more, thank you, put more people out there. And I just want to end with some good news. You know, the good news is that so many people and organizations rose up to help in the last few years. We just need to make sure that everyone doesn't think this is over. One leader told me she had a lot of hope that as a society, we are making choices about how we want to spend our time, hoping we will feel more connected through our communities and caring more for each other. There's still a lot of work to be done. We need to set goals. We need to be mindful of what equity is. We need to find the shoreline and head towards it. So let's do it. Thank you.
Thank you, Kathy. It's a harsh reality, but it's nice to hear that we have some sunshine on the horizon in terms of you know, what we're capable of and how folks can contribute. So thank you. Next, we will dive a bit deeper into the financial aspects of COVID by hearing from the dynamic Bret Sweet. Bret is the East Bay Program Director of Renaissance Entrepreneurship Center. He joined the center in February of 2015. He brings 2 decades of experience designing companies to change human behavior for the better. He has started digital media companies, social enterprises, and education companies. In March of 2016, Bret entered and won the Chevron Equip project pitch, securing $3 million to build a business incubator and co-working space in downtown Richmond, known as CoBiz Richmond, which opened for business in August of 2019. In November of 2020, Bret was honored with the Economic Justice Award by the East Bay Leadership Council. Welcome, Bret.
Thank you. Thank you, members of Impact 100 East Bay, for having me. I want to give you some more good news, but I'm going to add on to a lot of what Kathy is talking about. We are those nonprofits that fill in the gaps, that do a lot of things for the government. And so I thought that pivot was really appropriate. Next slide. So a little bit about me. I've been doing this a while. I don't think I'm that special. I think what's really interesting to me is I like human gardening. And what I mean by that, I'm really into sort of like ecosystems. I like seeing businesses talk to each other and growing and solving problems. And so that's where my focus is, and sort of rather than trying to be first all the time, always trying to make sure that we can get a relationship built between industry and residents, because that's what we're in this for. Next slide, please. So let's talk about where we're at right now. So Renaissance serves about 8,000 to 9,000 clients a year across 7 of the 9 counties in the Bay Area. When the pandemic started, we began surveying our clients monthly, and the things that we found that are a theme that I'm going to say that are still a theme is essentially 45% of clients, you know, they cannot receive digital payments. They don't have reliable bandwidth to where they can get on the Wi-Fi and use these alternatives. And they don't have any training around how to use the internet or the tools that are on their phone or their computer. So if you remember, when everything shut down, people said you have to be online, right? Nobody was ready to be online. The second part of it is that these entrepreneurs are hugely disconnected from their customers now. They don't understand how much their customers are going to spend. They don't know if they're going to see their customers every week. It used to be that I would see the same person over and over again to buy a cup of coffee from me. Now that this person doesn't have a commute, is that going to happen? Meanwhile, the customers are figuring this out. Is my job going to keep me? How long are these stimulus payments are going to come? Can I guarantee, should I even buy coffee anymore? Should I make it at home? Should maybe I just, you know, drink my kids' Mountain Dew and use that for caffeine? You know, these are the decisions that people are making. So it's very hard to estimate. And then on top of which, as I mentioned, we've removed the commute. We've taken it out of the situation. The house is the new area. And so I don't know about you, but even leaving my house for a new rooftop bar, the walk of 10 blocks is super amazing to me. You know, I'll be waiting in line like, oh, this is cool. But that's most people, right? That's their new activity, going to Costco and seeing if you have toilet paper this week. So everything is really focused about the locality and keeping it very close to home. But the challenge is that we continue to wait for government to be the answer to these solving, and they're not. It's the small businesses that do this. And then finally, I think small business owners, from what we're seeing, is looking for a sort of different kind of mindset. They want a demonstration about better money habits. They keep hearing about them. They see TikTok videos, they see YouTube videos. This is the right way to use your money. But the people who do have the money, they're not able to sit down and have a drink with them or have a cup of coffee or a meal and say, how do you do it? I see you every week. You're buying a dress. What should I be doing that's like you? And so there's a little bit of a lack of a role model. And there's also not a feedback loop that's let them know when you're doing right, it looks like this. They do not have an opportunity to socialize with their customers outside of being on the other side of plexiglass and a mask and all these scary things. Next slide, please. So Renaissance has tried to do a couple of things to address this, especially in the East Bay. And by East Bay, we're talking about Contra Costa and Alameda County. We really tried to take our in-person programs and turn them virtual and try to engage with them. We recognize this is a flawed system. You know, not everybody is prepared to go online and do that with a Zoom. Not everybody knew what Zoom was. They have phones that are difficult. So we have to try to get everybody to stop doing in-person and start learning to get online. Once we do that, we try, and this happens piecemeal, right? Because it's as we learn something, we have to change it, and we're not able to do it everywhere. We might be good at doing it in Richmond. We might not be so good at doing it in Bay Point or Pittsburgh, but we're still trying. So once we've got people online, then we try to teach them how to use the computers they bought or the phone they bought or the software they downloaded. Sometimes they're downloading 6 software that do exactly the same thing, and they're locked into 1-year licenses, right? So you can think about that. That's $2,000 they shouldn't have spent, and we have to kind of dig them out of that hole. We also thought about a lot of industry-specific training around COVID. You know, it's very obvious what to do if you have a restaurant. You put on face masks, you make everybody test, you put food, you do orders, right? But how about anybody here do yoga? My family's really big on hot yoga. What are they supposed to do? How do you make it safe for them, right? How about the gyms, these super spreader events, right? Was there any guidance on that? There is none. So what we have to do is figure that out. And back again, I'm so glad I went after Kathy. You made it so much easier for me. Thank you. The other thing is nonprofits. Who's helping nonprofits? There's this assumption that because you started a nonprofit, you know the answer and you need support just as bad, right? And we saw that in some of the data earlier. And then the final thing is we're trying to give out resources. We've been able to fundraise a little bit, give out Chromebook here and there. We have a great relationship with Square. Well, they're the company now called Block, but be able to give out point of sale systems. We don't do, and track these things and talk to people and say, how are you changing your business and how is this important? So and as well as giving capital, we've been able to give out tons of grants through a great partnership with the CDBG of Contra Costa County. We're working on doing that in Alameda County as well in the city of Oakland. 5,000, 10,000, 20,000. These go a long way, right? If you're a business trying to pivot, but again, there's still a struggle of capital and sort of having the technical assistance. Next slide, please. So kind of some trends that I think everybody here is seeing, but you may not know that you're seeing it, and to kind of like wrap your brain around it. First one is businesses are trying to understand what is going to be the new, okay? Are we working from home? Are we returning to the office? Or was I in between in the beginning and I was doing in the field, right? Renaissance is trying to solve this for ourselves, much less solve it for other businesses. So it's very hard to figure out. Also, we're seeing these new innovations that are coming to the market that are changing the way we're doing stuff. There's restaurants who all they do is delivery now. They have no interest in you sitting down and having a meal with them, right? You have drop ship retail where you order it online and it's thrown into a box and comes direct to you and it's never hit an inventory shelf. You also have subscription boxes. Try a little bit of this, try a little bit of that. So the models have changed radically and we're losing the face-to-face, but we don't understand if we're doing it right yet. Because numbers by itself, sales by itself, doesn't mean necessarily that people are satisfied. And then the final one is some models where people are literally saying, I've decided you're the bad guy, and I'm going to start a business to fight the bad guys. This sort of Luke Skywalker, Darth Vader moment that's really interesting. Doesn't always make sense, but that's people are betting their whole livelihood on it. Next slide, please. So here's a couple innovations. On the slide on the left is a really interesting business. They're called Refill Bottle Shop. And essentially what they do is they're like a commissary. They study Amazon data in the area. I just hinted to that, right? These behemoths. And they figure out what people are buying. And what they did is they set up an area where you walk in and on one side of the room, you can get oats, you can get quinoa, you can get all your sort of what we used to call, maybe I'm dating myself, a dry foods store, right? And you can buy it directly and you bring in your own bottle. It's one price. If you use one of their bottles, it's their price. You can also have it delivered by a bicycle. They hire teenagers to deliver the stuff by a bicycle. Anything you're thinking about, agave, honey, dried mushrooms, things like that. So they've transformed the grocery store. And before this was a dry cleaner that went out of business because of the pandemic. They use the same amount of space, and they have this amazing model that I'm seeing really spreading across the Temescal Rock Ridge area in terms of that. So that they're definitely pulling stuff out of the hands of the GoPuffs, the Ubers, the DoorDashes, as well as the Amazons. On the right is one business I find really intriguing. There was a retail gym called Sweat. And what I mean by retail gym, something maybe less than 1,000 square feet. Maybe most people's offices are bigger than this gym. You go in there, you do interval training, you go in at 6 a.m, you get out of there by 6:30, you get your workout and burn your calories. Obviously, this doesn't work when everybody has to social distance in 2020. So what they did is they went and bought a old oil changer that had been burnt out on San Pablo Avenue and converted it to an outdoor interval gym. And so they're turning over maybe 40 classes a day and serving about 400 people. You don't have to worry about masks because you're outdoors, right? Now, the person in the picture is obviously wearing a mask, but the safety is there in terms of that. So these are some of the models that we're seeing that people have kind of decided, I'm not going to wait for you to decide what the new is. I'm going to make the new. And that's, I guess, what's kind of interesting to me, what I love about entrepreneurs. Next slide, please. So in closing, some of the things to look at in terms of our economy, and especially the small business economy in the East Bay, is in your neighborhoods, in your region, in the places you're around with your families, there are new models that are interesting. They don't know that they're interesting yet. They're really on the gamble. When you see them, embrace them, spend time, say, can I talk to the owner? Not to complain, but I really think what you're doing is very cool. How do I lock this in so you stay around here? How can I figure out a way that I can buy from you once a week or twice a week? So that way, that's great. Second thing is find more events and places like this to the winners that are driving the ecosystems. Make sure that they know that they are a leader in their community. Make sure, because they're doing the good help. I think I always give a reference, and I'm focusing on this because gyms and body practitioners and everybody who has one-on-one contact, I see they had the least amount of grants, they had the least amount of funding, and nobody had help for them. So I was thinking about this, but when I see somebody set up a new system where it's very safe and they put in a $40,000 air filter and they're trying to figure out ways to give massages to elderly populations, so that way people are, who are dealing with chronic illness are not in pain anymore. I'm like, you have to tell your story a little bit better. And I almost wish I had brought them to tell their story today, because this is how we succeed when we find out what's working, and they can go, well, I've been in business for the last 6 months. I've had maybe one COVID scare during this process. And these are all the reasons why I made it safe and how I made it safe. And then that model becomes an innovation that we all study and we all copy, because that's the way it works. Thank you very much for your time. I hope that was less than 10 minutes and I didn't talk too much. Appreciate you.
So thank you, Bret. I think, you're definitely, what you conveyed helped me and hopefully the group this evening understand the financial and job related aspects as it relates to, small business. May I ask you a question? I know you have to leave early, and we are moving quickly. And I guess my question would be, what has been the biggest pivot that Renaissance, Ren Center has had to make over the last couple of years with ensuring that our community continues to be served? There's obviously a lot that you're doing for the community. And so I'd love to hear very specifically, because of COVID, what does that mean? What kind of mentorship are you doing these days?
I'm going to try to answer this in multiple ways. I think it's kind of omnidirectional. First of all, obviously, going from something that was influenced as being online to being pretty much virtual changes. And what does that mean? In the East Bay, in a Richmond class, a good class had 12 people. They stayed for 10 weeks. The pandemic put something like 40 people in a 10-week class, and they stayed for 10 weeks. The numbers just change overnight, right? Is it always a great experience being on Zoom for 3 hours for 10 weeks, right? We don't know yet. We're trying to figure that out. But getting people into those classes was a huge pivot. In addition, trying to figure out ways to put together curriculum for that business owner. Some of the members here are business owners. You don't have time for those 3 hours. You have to debate between your family, between running your business, and some time for it to be you. But if you could watch something and take a class at a level that's not as expensive as Coursera or Udemy or any of this stuff, and then tune up your business, this has been our approach we're trying to get. So one of the things that we're learning that we have to do is we can't just assume that you know how to get into the class. We have to give you a sort of some literacy. We have to teach you a little bit of maybe about Google Sheets. We had to remove a lot of our assumptions. The second piece of that is we want people to be ready to do consultations, but we realize that not everybody has ever been on a Zoom. They don't know what a meeting is. They don't know what coaching is. So what we've tried to do is make a little bit more of a runway by doing a volunteer mentorship program. And that's where we're able to kind of bring in people who just volunteer. Maybe they're a college student, maybe they care about the local community, and they can meet with somebody once a week, free of charge, and they talk. And then when that person's mindset is shifting and they've had 6 to 9 weeks of trying every week to use Zoom, we could scale them up into like maybe doing a calendar. And then that way that calendar goes on their phone and they understand these principles. And then eventually, by the time they go into being in a one-on-one coaching session, they're really prepared and they're not overwhelmed. Another thing that has been a huge pivot is we have always gotten people ready for capital. We have never been the ones to give them capital directly. And that was a huge transformation that started for us in 2020, where many funders came to us and said, you know what the businesses need. If we give you the money, will you give it to them directly? And so that was a mindset shift hugely. We had to learn some of the ins and outs. One of the things I started a fund in Contra Costa that was essentially about $500,000 to give out grants. And one of the things that we were learning were there were businesses who used to live in Contra Costa, but they now have to live in like Rio Grande and they still run their business because they can't afford the rent residentially in Contra Costa, but they can afford the commercial rent for their business and vice versa. So we had to learn a lot of the ins and outs of dealing with folks around that. And then I think the final huge pivot that we've had to learn is, how do we work virtually? What does that mean? I'm sure everybody here is still figuring that out, but we are role modeling for our clients in a lot of ways. So some of us like to get together in person. That's fine, but we're not always sure that's safe. Some of us want to message each other on Slack and send memes and make each other laugh with songs, and that's cool too, but that may not be everybody else's culture, and that's going to be a shift for them too. And then we have to translate that over to our clients and say, how do you do that with the rest of the people who are working for you, and how do they feel safe? So there's a lot of guidance. And I also felt like, to be quite honest, there was a lot of COVID safety that we were required to explain to folks that I don't think was in our wheelhouse, and nobody was paying us to do it. But it was just, quite honestly, explaining to people, before you come in this building, I need you to wear this type of mask, and have you been tested lately? And here's this, we just had to be public health officials overnight. And so I think the biggest transformation was Renaissance went from being this sort of clinic, right, to where when your business is in trouble, come by and we'll wrap it up and make sure we'll help you. So we had to become EMTs. We became almost like economic ambulance workers and triage doctors, where we're like, we understand that you got 3 months of cash, and if we don't help you, your business is going to close. So let's get to work. I hope that answered your questions.
That was fabulous. Thank you so much. Really appreciate your insights. Next, I'd like to introduce Caitlin Sly. She will provide a perspective on food insecurity in our communities, especially the effects on our elder population. So Caitlin is the Executive Director of Meals on Wheels, Diablo Region. She joined the organization in January of 2020 and brings over 10 years of extensive experience of anti-hunger work with an understanding of the food insecurity many seniors face. She previously served as program director at the Food Bank of Contra Costa and Solano. Caitlin also served as the board president of the Concord Chamber of Commerce and continues to sit on their board, as well as the board of the Walnut Creek Chamber of Commerce and Visitors Bureau and Meals on Wheels, California. Welcome, Caitlin.
Thank you so much for having me. It's a privilege to be able to be with you all this evening. And as Judith mentioned, I'm Caitlin Sly. I'm the Executive Director of Meals on Wheels Diablo Region. And just to give a brief summary of our work at Meals on Wheels, Diablo region. Most people know of Meals on Wheels, and the name is kind of self-explanatory, and they know about our flagship program, which is delivering home-cooked meals to low-income seniors throughout our community. But many don't know that what Meals on Wheels Diablo region does is so much more than a meal, that we have a lot of supportive services like fall prevention and exercise classes and companionship programs that really aim to serve the whole health of what seniors need in our community. So that's kind of the perspective that I'm coming at you with today, and going to share a little bit about what we've seen at Meals on Wheels Diablo region, which serves Contra Costa County. And I think what we've seen is also very true for many other communities throughout the Bay Area as well. Next slide. So as we know, with many things that COVID touched, it really exacerbated problems that were already there. So food insecurity among the senior population is not something that is new, especially for those of us that work at Meals on Wheels organizations. We know that this is an issue that has existed for a long time. In 2019, it's estimated that 1 in 14 seniors experienced hunger, and that level is higher than before the recession in 2007 and 2008. So showing that the senior population has not bounced back from that recession. And again, that was before COVID. And it's estimated that over 45,000 seniors in Contra Costa County are either on food stamps or on Medicaid. So again, lots of low-income seniors that are struggling. And that is true for many different reasons. There's a lot of social isolation even before the pandemic that we know seniors face. A lot of that is because they may have outlived their friends and their family, and even sometimes their children. And so that social isolation, we find that low-income people of other ages often rely on their social networks to get by. But when you don't have a social network, that can be really difficult. And that's what leads to a fragile support system around you. We also know that older adults are typically on fixed incomes, either living off of a pension or Social Security, and those typically do not keep up with growing costs that we see. So there's food insecurity as a result of that. And then also barriers to getting around. It's hard to get out to get food when you may not be as mobile as you once were. Next slide. So as we know, COVID just made existing issues that much worse. We have folks that are 60 and older were definitely more afraid to go out with COVID, especially since the disease is something that particularly affected older adults in a more impactful way and was more risky for them. So many of them were very afraid, understandably, to go out. And for many, what they did have for a fragile support system really started to break down during this time. We had one client that called us, and she's in her 90s, and she said, you know, I really need more food. I used to rely on my young friend who would bring me occasionally groceries. And we asked, well, how old is your young friend? Well, it turns out her young friend was 75 years old. So we really saw that seniors were relying on other seniors to get by. And that young friend ended up sheltering at home and needing our services and became one of our clients as well. We also are, as we all are experiencing right now with inflation, costs are increasing even more. And so that fixed income goes less far now than it did before the pandemic. Next slide. What we have seen as a result of COVID and a result of the growing food insecurity among seniors in our community is a growing need among the people that we serve. So because of COVID, we saw a 40% increase in the number of people that were coming to us needing home delivered meals. And as you can see, that has just trended upwards over time. And we don't expect that to go down anytime soon. In addition to an increase in people needing home delivered meals, we also saw an increase in people requesting home modifications. So one thing that we do that's unique of our Meals on Wheels organizations is that we have a fall prevention program where we actually go into the home and install grab bars and shower chairs and railings to make the home safer for folks. And what we saw was, as people were sheltered at home and less mobile, that they also needed more fall prevention help and assistance. And I think there's a few reasons for that. One being that as we are less mobile and we're not getting the physical exercise, then we're more prone to falling. And also there were more family members checking in on their older parents and seeing the situations that they were living in and really being worried and reaching out to us for help. We also saw an increase in people needing to connect with our friendly visitors. We match low-income seniors with volunteers to provide companionship and really combat that social isolation. And we saw more and more people needing that as we all have felt more isolated during this time. Of course, to keep people safe, we had to do that all over the phone, but it really was a lifeline to many seniors who felt completely alone, and really the anxiety and depression that people felt during this time has also been difficult. We also operate 6 different locations where people can come sit down and have a meal, and all of those locations had to go to home delivered meals. So it just, the need for home delivered meals skyrocketed among other services. We really don't see the need decreasing anytime soon. I think that there's many different reasons for that. One is that the population that we serve is definitely going to be the last that will go back to normal or will feel comfortable going back into society. We also have a growing older adult population. That was true before COVID and is still true. So the population that will need our services is growing. We also see increased lack of mobility. After 2 years of being sheltered at home, people are less mobile and less able to get out and get their own food. And that social support system that people have is also aging. So we have one client, her name is Jerry, and she's 93 years old, and she lives with her daughter who is disabled, and Jerry at 93 is the sole caretaker for her daughter who's 65. And we were serving Jerry and delivering her meals until we realized that she didn't have enough because she was also sharing them with her daughter. And we had to tell Jerry, we can put you both on meals. We didn't know that you both needed them. You're both seniors. We're here to serve you. But that's the kind of situation that we're seeing where seniors are taking care of seniors, and someone who's in their 90s is still a caretaker. And then we also see hunger is definitely a result of some of these external factors and a cause. So it's kind of a cycle. When we often talk to our clients and they come to us for food, we end up finding out that they have other needs. They're coming to us for food because they've been saving all their money to pay their rent and they don't have money left over for food, or they've been using their funds to help a loved one or a friend. And so we're really able to work with them. And that's why we have case managers that are able to help connect them to other services that hopefully can lift the burden. Next slide. So we have made some progress. It's not all bad news. That while the need is increasing, we definitely at Meals on Wheels Diablo region have come up with some innovative ways of helping people get that extra assistance. So we started a breakfast bag program because we know that our one meal a day is just not enough. And so for our most food insecure seniors, we deliver a week's worth of breakfast food like hard-boiled eggs and string cheese and yogurt, oatmeal, and those kinds of things to help sustain them throughout the day. We also started a grocery bag program, which is a partnership with the food bank, and we deliver groceries to our clients that can still cook for themselves. We started a friendly helper program where we match volunteers with seniors that need someone to run an errand for them, pick up a prescription, go grocery shopping. We've also started a collaborative of specifically focusing on East Contra Costa County, where we know the need is great and there tend to be a lack of resources. And so in partnership with other senior serving nonprofits, we collectively hired a staff member to work on all of our behalfs to reach out to underserved communities in that area and connect people with our services. And then lastly, as we start to open up again, looking at different ways that we can serve the many generations of seniors. And that is looking at how we provide our congregate feeding or our cafes that are typically held in a senior center site. But for some younger seniors who will never go to a senior center, we have opened a site in Brentwood that is actually located at a restaurant. So folks can go to their local Mexican restaurant and have a meal there for free instead of going down to the senior center. Next slide. So ultimately, I think that what this pandemic has really taught us is that this could happen to any of us. We have one client who had a great job. She was employed. And when the company that she worked for got bought, she was let go. And at that same time, she started to suffer with some really serious health issues, which she didn't have health insurance anymore. And so that put her in some financial dire straits. And now she really relies on us for many different services, including home delivered meals. And if you talk to her, she says she just really never thought she would have to rely on us. She never thought that this would be something she needs. And I think that really rings true to many of us who do this work, that it really can be just one unfortunate life event that puts you in this position. And our elders really are those that built the society that we live in and should be taken care of. And so I hope if there's any good news that comes out of the pandemic, it's that people are more aware of the plight that seniors face and are more willing to step up and help them out. So thank you for your time.
Thank you, Caitlin. That is, it's heartbreaking information, but it's good information. And it's great to know that there are things that not only Meals on Wheels are doing, but that we can do as well. So thank you. And finally, I'd like to welcome Adamika Arthur, who will be addressing the health and wellness components of our program. Adamika Arthur is the CEO and Executive Director at Health Tech for Medicaid, a national nonprofit dedicated to supporting innovation in Medicaid and further improving the quality, equality, and access to care for Medicaid recipients, their families, and communities. Arthur is a proven healthcare executive with strong management track record and over 20 years of experience as a clinical epidemiologist, public health leader, and hospital administrator. Adamika helped author the 1115 waiver that expanded Medicaid in California and brought over $180 million to improve service delivery and care pathways for millions of Californians. Arthur has a master's in public health from the University of Washington and a BS from Clark Atlanta University. Welcome.
All right, well, thank you. I think I'm unmuted, right? Okay, good. Well, I wanted to say that I got an opportunity in Alameda County to really test my public health chops. I came from the Centers for Disease Control to Alameda County, and so and was a hospital leader in Northern California, mainly in Alameda County and San Francisco, for many of my much of the last 15 years of my career. So next slide. I'll talk a little bit about Health Tech for Medicaid. Following slide. We're a national nonprofit, but really, as mentioned earlier, filling the gap in being a mission-based market enabler, right? That facilitates kind of the cross-sectoral gap between what happens in Silicon Valley and other places where we think of innovation and where those innovations actually come to. So our goal is really, it's threefold. We do a lot of demystifying of Medicaid. I think if you know a bit about Medicaid, it's 1 in 3 Californians are on Medicaid. We have now at this point over 81 million individuals on Medicaid across the country. We also do a lot of infrastructure and ecosystem development, and then we provide a forum. We are a convener where payers, providers, policymakers, entrepreneurs, investors, and people on Medicaid, their caregivers, family, and community can come together and provide solutions. Next slide. I'm just going to kind of skip over our pillars of impact, but I do think that one of the things we often don't think about is how can we have our communities be a part of the solution in co-designing what it is that they need for their lives. That goes kind of to the next slide. So I want to talk a little bit about health equity. And oftentimes you've heard these terms brought around. I sit on the White House Council for Health Equities. I've been doing this work for a very long time and I'm helping the administration. But health equity really is attainment of the highest level of health possible for all people. And that means achieving that requires valuing everyone with a focused and ongoing societal effort to address unavoidable or to address avoidable inequalities. The earlier speaker who kicked us off really talked a little bit about what would happen, right, if nonprofits kind of ran other services. And I will say that there are some large areas when we look at equity, socioeconomic, institutional and structural, societal things that really create or potentially exacerbate health disparities and health outcomes. Next slide. So we often talk as public health leaders about social determinants of health. I do want to have the audience think a little broader than that. There are economic determinants of health. There are environmental determinants of health. There are also political determinants of health. But strongly in public health, we look at the social determinants of health, and how we look at that are what are the cultural and environmental conditions or the socioeconomic conditions that impact our ability to live, work, and play. And I think, as you know, there are many zip codes in Alameda County and Contra Costa County, but what you probably didn't know is that your life expectancy can dramatically change based upon where you live, what your zip code is. And that is due to living and working conditions, unemployment rates, which do vary by zip code, your education, your housing. We heard earlier about your entrepreneurial economic development. You know, one of the things I always tell people is the largest economic indicator is our health. If we're not healthy, we can't contribute. You can't be a good entrepreneur. But also our food availability, as we've kind of touched on earlier today, our access to mental health services. Next slide. And so when we look at COVID-19, and I'm going to speak specifically to Alameda and Contra Costa counties because of the audience today, but knowing that we have physical, psychosocial, social economic, and institutional and structural impacts that occurred very clearly in COVID-19 and are still occurring, right? We heard earlier, right, that there are some physical considerations. Morbidity and mortality in COVID was really directly impacted to, we looked at cases and hospitalizations, but if you didn't have a hospital near you, right, your likelihood of having a direct health impact was very great. If you didn't have access to the needed care that you needed to actually function. The psychosocial components, we talked a little bit earlier about social isolation, stress, mental health, which I know you guys as a group have talked a lot about, substance use, and also violence, family violence and community violence. And also the socioeconomic considerations, loss of wages and work, as we heard about earlier, unemployment, small business strain, how your education could impact you getting into the workforce, housing. We all learned deeply how the education system was impacted. And there always are structural and institutional issues around the health system burden, right? The safety net strain, right? Racism and xenophobia, and other things that have impacted. Next slide. So if we looked at Alameda County, you can go ahead and keep it, but we had earlier, in looking at Alameda County, there was a slide that really showed how health equity in Alameda County was really impacted. And we saw some of the areas of greater density of COVID also had many of the things we talked a little bit about, where it pertains to looking at protective measures for folks, thinking about policies like moratorium on evictions or foreclosures or utility shutoffs, thinking about emergency economic assistance and social benefits. So oftentimes we don't have the data timely to be able to make these sorts of declarations, to look to see why and where disease states are impacting our health even further. So as we already had challenges around life expectancy and health outcomes, right? COVID-19 really put a burden and an additional damper on that for others. Next slide. And so I wanted to talk a little bit about inequities, right? Because we talked a little bit about earlier, what a health inequity is it's really a difference in health status between groups, right? And why that's important is because when we talk about health equity, we're not talking about health equality. Oftentimes folks think about equality. We all should get the same thing, the same stimulus check, right? The same access. But if you're already further marginalized or minoritized, you may need more, right? And how do we look at that rationalization across our communities? How do we think as grant makers, like as you guys are, about who do we impact and how can we better address the inequities that are creating additional burden? Those inequities are typically caused by systematic differences in social conditions, and they're in most cases avoidable, unjust, and actionable. But they do take resources, effort, time, and we also take using data to understand which groups may need more or less of something. Next slide. So, I'm a real advocate. I'm an epidemiologist by training. I was a hospital leader for a long time. I spend my day in my life today really helping communities think a little bit more about how can we improve the quality and duration of lives and livelihood around us. And that is, we really need to use data. We need to use data to advance our knowledge of health equity. And that really helps us figure out where do disparities exist, figuring out how do we direct our efforts and our resources to address some of those disparities, how do we measure progress, and have goals specifically around achieving greater equity, and how do we establish accountability and community accountability for progress. Next slide. I wanted to lift up a recent white paper that Blue Cross Blue Shield of California, which is headquartered downtown Oakland, did a really great job of really detailing how do we look at disaggregating data and thinking about how we standardize race, ethnicity, language, and other data for us to have real-time ability to make action. I will tell you, I did a little bit of a search on the web, knowing a lot about Alameda County, having been an epidemiologist at the county a long time ago. But many of our reports, right, they're funded through different mechanisms, and they're really dated. Looking at something of data back in 2010, that may not really be applicable to what's happening today in 2022. How can we work together? And I think one of the things we saw beautifully tonight through this talk is a collaboration of nonprofits, looking at small business, thinking about how we mobilize around food insecurity or other work streams of health inequities. How can we work together to partner and collaborate and utilize all of our details and our ability to serve the same population better, right? So that we're not duplicating resources, but we're expanding resources further. And how do we leverage this information around social needs to inform where gaps exist and to help target resources and figure out where do we need adequate assistance? Where do we need to have programs? Next slide. So that really is a lot of what I wanted to talk about today. I think many of us have heard a ton about the things that are necessary or have been necessary throughout the COVID-19 pandemic. Contact tracing, hygiene, isolation of the sick, physical distancing. But we haven't really talked about how can we target our resources and messaging and support for marginalized and impacted populations where we're not further adding a burden on to our already challenged community.
Thank you so much, Adamika. And quite honestly, thank you, everyone who's spoken this evening. It's engaging. It's inspiring just to hear, even though we know there is so much challenge out there, but it's great to know that we as individuals can do more, and we know that there are ways that we can help, which is really fantastic. So bring there, and I know I have one, if which I think actually speaks to it up to the panelists to say, what do you feel we can do as an organization and holistically as a community to help bring these different pieces and disparate industries together to help partner and help our nonprofits do what they do best? So just throwing it out there to anybody who would like to address that.
Well, I can just speak, having the benefit of doing national work and local work at the same time. I would say that oftentimes we don't do a very good job of landscape analysis and really figuring out how can we better support each other. And part of that is just how nonprofits are funded, to be fair. It is very challenging, and I see Caitlin shaking her head, but it's very challenging for those of us who actually, you know, when Kathy spoke, she was like, it's really great that nonprofits supplement what the government does, but I will say it's super hard to do that work. It is very challenging for us to fight the burden of the gaps in our system, right? So we do gap analysis work and move our programming to where government funding has gone, and we run after philanthropists to get that work done. It is an ever burdening cycle. I will say this is the hardest job I have ever done in my entire career. And I have worked in some of the most challenging systems, right? I will, you know, I worked at Alameda County Public Health Department. Before that, I worked at CDC. Before that, Seattle King County Public Health Department. I worked at Alameda County Medical Center, which is an Alameda Health System. I worked at UCSF as a hospital leader. I worked at Sutter as a hospital leader. This is the hardest job I've ever had, because every day it's the most inspiring job. I get to wake up every day and know that I'm making a huge difference in the world. But it's also on the backs of my staff and my team and the people we get to serve. If I don't bridge the gap in the money we need to do our programming, which we do on the leanest possible budget, you know, that is a failure, right? And so we don't evaluate nonprofits in the same way. It's also very challenging for those of us with a business acumen and you know, have given up big careers and big jobs and big paychecks, right, to live on the side of passion and purpose. There should be an allotment of allowing for us to have a living wage as well. So I don't know that really answered your question. I just to put in frame.
Yeah.
In order for us to work together, we have to be able to have the capacity to do that.
Yeah. Yeah. Makes perfect sense. Caitlin or Kathy, any thoughts around that?
I would agree. I mean, just building off of what Adamika said, I think it's, you know, the more time that we can spend on our mission, the better. And I think that for nonprofits, one of the hardest things that we do is jump through a lot of hoops from government funders or private funders or funders in general. And we often spend a lot of time tracking and paperwork and all of this kind of thing, when really what people get into this work for is wanting to serve people in need. So I think as a funding body, one of the main things you can do is try to, reduce some of those barriers and really hopefully help nonprofits be able to do their work in a more streamlined way. And I think, bringing nonprofits together in a venue like this is certainly really helpful, as well as we always learn and share from each other and create connections. So I'm glad to have met other people on this call as well.
Yeah, and I would just quickly say too, your funding, to really make sure that there is allowance in there for, I hate to use the word overhead, but beyond just the cost of the program, because that doesn't allow for the people who, it's just not enough. We get cut so tight that people work themselves to the bones without having the correct amount of funding for it.
Yeah. Yeah. Any other questions for this evening? I know we're already over time. It went very quickly. Okay. Well, first off, I know that I'm leaving this evening more knowledgeable about how our communities have been impacted by COVID and how we are progressing. I think it's clear there continues to be a significant need for services, for what you do, for what we do, for volunteering and for funding. I'd like to thank our 4 incredible speakers for this evening for imparting what you did. Thank you so much. I also can't wait to dig in deeper. And thank you for those folks who were able to attend tonight. I know there will be many folks who are able to review this recording afterwards, so thank you. As you know, we have a bigger impact because of that, so that's fantastic. And thank you, quite frankly, to everybody who helped organize this event. I'm grateful. And as always, if you feel inspired to do more or would like to become a member of Impact 100, please reach out to me or another Impact 100 member, or log onto our website. It's here on the screen as well as in the chat, I believe. Yeah, or forthcoming. Okay, anyway, with that, have a wonderful evening. Thank you and good night.
Thank you.
Thank you.
Thanks so much. Wonderful presentations by all.
Thank you.
Thank you for all that you do.
Yep. Thanks all.